Hello, and thank you for joining us for another Medicare education session. My name is Keith Knabb of Affordable Medicare Solutions. We are the largest Medicare planning agency in Georgia, also the most award-winning. And today we're going to be talking about the subject of Medicare and transitions. How do you manage your Medicare during a change of life? So let's get to the presentation and learn something new. Managing Medicare during a move. Medicare is not set it and forget it. Not managing your Medicare can be a big mistake financially and health-wise. And this is something that needs to be managed every year. So people don't understand that Medicare changes often. Every year, the changes can affect your out-of-pocket expenses. Your Medicare deductibles change. Your plan deductibles can change, as well as your drug costs. There's been some dramatic changes between generic and brand name drugs and what pharmacies you can use. What doctors and what pharmacies you can use can change every year on your plan. This is very important that you check each year. And there's also help. So as someone's income has changed, if their assets and income have dropped, maybe a spouse has passed away, there's extra help for low-income people and also people that have chronic illnesses. Very important to pay attention to these new programs from Medicare. Let's talk about the eligibility for Medicare. And to start at this point is to understand that Medicare is eligible for people that are 65 and older, but also for people who are disabled. So managing Medicare for a disabled person who's under 65 is quite different often than somebody who is 65 or older. And then there's also people in category number 3 which have chronic illnesses such as Lou Gehrig's disease, ALS, or end-stage renal disease. Those people are in often big time transition in their life and maybe changing where they live and how they're receiving care. So Medicare and Moving, this is very important. There are different types of Medicare programs, and one of the primary types that has been around since the 1970s is something called a Medicare supplement or a Medigap insurance plan. Well, those plans can change with you and move with you easily from state to state because they are national. If you buy a Medicare supplement in Georgia, it applies in California, New York, Alaska, wherever you go, that's fine. And they can move with you from state to state. Just check with your program and make sure that you're fine going from Georgia to Alabama, Florida. You should be just fine. You can call my office. A big problem, though, is under the Medicare Advantage plans. These are the HMO and PPO new style of Medicare plans called Part C of Medicare, and also the prescription drug plans called Part D of Medicare. These differ not only from state to state, but under the Medicare Advantage plans, they can differ from county to county. But definitely, if you're crossing state lines, you're going to have to manage and change your Medicare Advantage plan and your prescription drug program. Really important. But first, when you move, you'll need to notify Social Security of the move. Why not Medicare? Well, Social Security manages your income benefits, your address, and notifies Medicare of your address changes. So once you notify Social Security of the move, you may qualify, you will qualify for a special enrollment period. This gives you 60 days around that move to be able to make changes to your Medicare. Sometimes families forget, they're moving mom. It's a big stressful time. Mom's had a stroke. We're moving mom from Tennessee to Atlanta, and they're too busy selling furniture and packing furniture and arranging new places to live and rebuilding homes or bathrooms and things. And they completely forget to call Social Security to let them know mom doesn't live in Tennessee anymore. Mom now lives in Georgia. Well, that's okay. So if you forget and you do it a little bit later, you'll get that 60-day window assigned to be able to manage your Medicare, her Medicare or the person's Medicare. Not a problem. Just call my office and we'll walk you through that. And so that leads us to describing enrollment periods. Your initial enrollment periods when you turn 65 and when you get Medicare, but the second one on this screen is called a special election. This is about moving. So you're moving and you need to manage your Medicare. It's called a special election. But even after you've moved, you might have moved in September, but in the annual election period starts in October. You'd want to go ahead and also plan to do an annual review during the annual election period. And if for some reason you've forgotten to do that, and you're under the Advantage, Medicare, HMO, and PPO style of plans, they also the government gives you January, February, and March, the ability to manage that also. So we've got a lot of flexibility, but the special election is the one we're going to use during a move. So the special election periods, the ones that we can most often are using is somebody is leaving employer coverage. That's one type of special election. Number two is moving from county to county or state to state or to a different facility. Maybe you're going from one assisted living facility to another assisted living facility. That's a move, and that's important. There's also special life events. Somebody loses a spouse, they get married, they get divorced, they get Medicaid for the poor. There's different life events that can also help us manage the Medicare. And if somebody's low income or has special chronic illness needs, we can also help manage their Medicare during the year. Those are all called special election periods. Let me give you an applicable scenario. This is the move scenario. Grandpa Ted moves from Florida to Georgia because he had a stroke, and Grandpa Ted goes to an assisted living facility. And that assisted living facility convinces him to incorrectly cancel his Florida plan and revert back to original Medicare. They think they're being helpful, but the assisted living staff aren't Medicare advisors, or advocates, or experts. They're just trying to be helpful, and they make mistakes because nobody's trained them properly. So Grandpa Ted loses his Medicare rights and can no longer use his special election period, his SEP, to be guaranteed the correct plan. So they screwed him up. So what should he have done? Grandpa Ted should have used a professional Medicare advisor, a person that's done this for 20 or 30 years that knows what they're doing, and for free, have no charges to Grandpa Ted, and use a professional to make sure that Grandpa Ted reports his move properly, exercises his Medicare rights properly, and is guaranteed the proper plan for himself for the rest of his life, or at least for the next year until his annual review. This happens all the time. Assisted living staff, nurses, social workers oftentimes give out incorrect advice, innocently making mistakes because they did not go through the right training. And that's unfortunate because they should be a good center of influence, but we see this scenario play out quite a bit, unfortunately. So thank you very much for joining us. The professional Medicare staff for Georgia that you can call is Affordable Medicare Solutions. We're at 770-945-5261. All of our services are free. Just give us a call. We'll help you do your annual reviews. We'll help you report to Medicare your move properly or any other scenario. We'll also refer you to other aging specialists. If you need help moving, you need help finding a place to live, you need help with home health care, just call our office and we'll tell you the professionals in Atlanta and Georgia that can help you. Thank you very much for joining us today.